It's been a year or so now, but you may have heard about this EAT Lancet diet, which is basically a predominantly plant-based diet that was promoted by a group of experts, and I guess I got to put experts in air quotes because they were sort of specifically selected experts, I guess you could say, to recommend a diet for a healthy planet, both for healthy individuals and for a healthy planet. Now, they were always sort of, the initial message was combined. This is healthy for people and healthy for the planet. But as happens with a lot of recommendations, it's not actually backed by any significant science, and it may not actually be healthier for people or healthier for the planet when you look at the details. Now, a new study really brings to light how it's probably not sufficiently backed by science to say it's healthy for the planet. For healthy for the individual, for the person. So I think talking about the details of the study and how that applies to the bigger picture of the dietary context is very important. I'm Dr. Brett Scher, the medical director at dietdoctor.com. And with that intro, let's jump into the study and then talk about sort of the bigger picture. So the study is called Association Between Adherence to the EAT Lancet Diet and Risk of Cancer and Cardiovascular Outcomes in Prospective Nutrinet Santé Cohort. And it was published in the American Journal of Clinical Nutrition. You know, it's, as I said in the intro, this proposed EAT Lancet diet was supposed to be the one diet, right? And right away, that's a problem, right? Anytime we propose one diet for a whole population, there are going to be major problems with that because, you know, there's many different ways to eat a healthy diet, especially for individuals, because it needs to be sustainable, it needs to be enjoyable, and that's going to be different for everybody. But what's so interesting I find about this is that these EAT Lancet recommendations were made without any supporting data. And to the author's credit, even though I think they were sort of biased or predisposed to thinking that EAT Lancet diet is healthier, they clarify in their introduction that there really isn't evidence to support that, and that's why they were doing the study. But first, a couple things about the intro. So they say it is now established that dietary fat, sugar, and salt have deleterious health effects and contribute to chronic diseases. Well, I'd argue that it's not so established that eating fat is necessarily proven to be deleterious. In fact, the opposite. I think we've sort of been exonerating fat over the past few decades, showing how it is compatible with a very healthy diet. They also said plant-based diets can help prevent chronic diseases. Well, again, what's the quality of the science there? It's mostly observational with healthy user bias, so forth. So you can sort of see their bias right away. Understandable, right? Everybody's got a bias. Everybody's got a perspective. But then they say plant-based diets can be rich in ultra-processed foods. So good for them to acknowledge that. Totally true. And then they talk about the environment, that they can lower the animal impact to greenhouse gases, which comprise 26% of greenhouse gas emissions. Now that is completely misleading. And we've had podcasts with Dr. Frank Mitlerner, and Diana Rogers. I go over more of the details of how when you throw around percentages like 26% for agriculture, animal agriculture contribution to greenhouse gas emissions, it's just completely false and misleading. So unfortunately, they included that. So they say EAT Lancet's a 2,500 calorie diet that encourages consumption of plant-based foods, including fruits, vegetables, whole grains, legumes, unsaturated oils, and limits beef, pork, lamb, refined cereals, added sugar, and fat. And they talk about how the initial proposal for EAT Lancet said that it could prevent 10 million premature deaths, like per year. Now that really gets your attention. Really, could it? If it could prevent 10 million premature deaths per year, I want to know about it. But there's no evidence to support that. And that's the problem when you start throwing around numbers like this. So again, to their credit, they then say EAT Lancet's already considered a universally healthy reference diet, although few studies explored its nutritional quality and long-term health impacts. So I'm very glad they recognize that, and that those studies that do exist sort of contradict each other. Some say it is, some say it isn't. So clearly the science doesn't back the recommendation. So, okay, this was observational study, right? Web-based prospective cohort. And they used 24-hour recall diet. So 3 24-hour recalls twice per year. So 3 days a week, twice per year. What did you eat over the past 24 hours? Again, not the best quality data. We've gone over this again and again. Not the best quality data, but it is what it is, right? So data in, the quality of the data in is going to equal the quality of the data out in the conclusion. So there's an issue there. And they computed an EAT Lancet diet index, meaning how close to adhering to the EAT Lancet diet were you. And what they wanted to see was what was the relationship to incidence of cancer and cardiovascular disease. So they followed for 8 years, 62,000 people for 8 years, average age about 50. Now, interesting, I always want to look at the baseline characteristics because so many of these studies, the people who eat what's promoted as a healthier diet tend to be healthier people because they're listening to your doctor. You're listening to what is being told to be healthy. So if you care about your health, presumably you should be following advice that people tell you is healthy. Unfortunately, sometimes that's misguided. But that was the case here too. Those who had a higher adherence to EAT Lancet diet had higher education, higher income, they were less likely to smoke, and they had a lower BMI. So right away, healthy user bias is in favor of those who were closer to adhering to an EAT Lancet diet. But the main conclusion was there was no difference in cancer and cardiovascular disease outcomes for the cohort. And then when you looked at all cancer by itself, there was no difference. Now, there was some difference when you looked at like lung cancer, or if you look specifically at women for cancer and heart disease risk. But here's the thing, once you adjusted for body mass index, those differences went away. So again, it was if you were a lower body mass index or higher body mass index, that had a much stronger impact on your cancer and cardiovascular disease risk than whether or not you adhered to the EAT Lancet diet. So, I've been critical of observational studies like this before because of the healthy user bias, because of confounding variables, because the differences are usually so small that they're not really meaningful for an individual. But here's a study that had the issues of healthy user bias, and it still found no difference, still found no benefit. So I think that's pretty damning evidence that this EAT Lancet diet is not proven to be healthier for individuals, which leads us to say, okay, well then why should we be eating it? Is it truly healthier for the planet and the environment? And that's a whole nother discussion that we've dug into before and will continue to dig into that is more nuanced than just a simple yes or no. But it's not fair to combine it with saying this is proven to be a healthy diet because the science says otherwise. The studies that have looked at it so far have been contradictory, and even they are lower quality studies. So it's clear a healthy diet for individuals can take on many different forms. So what is the take home? What's the practical take home? Is that there's not one way to eat, right? If you are eating a low carb, high animal product diet, but improving your health, then that is absolutely a healthy diet for you. And you shouldn't listen to somebody saying, no, any diet that involves animals is unhealthy, because that is absolutely not true. Especially if you've got your own N of 1 experiment, right? To try and dictate one diet for the world as healthy for individuals is just a complete misstep, especially when you can do your own N of 1 experiment. Reduce your carbs, increase your animal intake, and if you see your blood pressure drop, your weight drop, your blood sugar and insulin drop, your HDL improve, your triglycerides improve, right? And the things that we consistently time and time again see on low carb or keto diets. If you see that progression for you, then you know that even though your diet contains animal products, it is a healthy diet for you. So I think the big take home message is we really need to stop trying to pretend that we can prescribe one diet for the population that is healthy for everybody. And again, that doesn't even address whether it's enjoyable or sustainable for you, because we have to admit we're emotional and we have likes and dislikes and tastes and so forth. Food is more than just something we put in our body to promote our health. It's something we enjoy and need to continue to enjoy. So all those factors need to come together. And this study really just brings that to the forefront, that what was promoted by many as being the one healthy diet for everybody appears to not be so much. So hope this was helpful, both to look at the study and to sort of look at the broader context. If it was, please click thumbs up and subscribe, and we'll see you here next time on Diet Doctor News on YouTube. Thanks a lot, everybody.